Shin splints, a term that resonates with many athletes and active individuals, refer to pain that occurs along the shin bone or tibia, which is the prominent bone that runs down the front of the lower leg, starting just below the knee. This condition manifests primarily where the muscles attach to the shin, typically as a result of overuse or excessive stress on the lower legs. Medically, shin splints may also be referred to as medial tibial stress syndrome, a label that highlights the painful inflammation stemming from the overexertion of muscles, tendons, and bone in this region. When discussing shin splints, it is essential to recognize that they are not a singular injury, but rather a general term encompassing pain experienced along the front of the lower legs due to various factors related to physical activity. The discomfort can be categorized into several types, including anterior, medial, and posterior shin splints. Each type corresponds to the specific area of pain along the leg, anterior affecting the outer side, medial affecting the inner side, and posterior affecting the back. However, the most common presentation of shin splints is on the inner side of the tibia, where the pain is often most pronounced. It is crucial to differentiate shin splints from other potential causes of shin pain, particularly stress fractures. While both conditions can arise from similar mechanisms of overuse, a stress fracture represents a small crack in the bone itself, a more severe injury that requires different management. If you suspect you have shin splints but do not notice their improvement, it is prudent to consult a healthcare professional to rule out a stress fracture or other serious conditions. The symptoms of shin splints are often characterized by a dull ache or persistent pain along the front of one or both shins. This discomfort may intensify during physical activities, particularly those that involve running or high-impact exercises, and typically alleviates with rest. Additional signs may include tenderness upon touching the shins and mild swelling in the lower legs. Initially, the pain may be sporadic, only surfacing during exercise, but as the condition progresses, it can become a constant source of discomfort. The causes of shin splints are multifaceted and often linked to repetitive stress on the lower legs. Engaging in high-impact activities or making sudden changes to your exercise routine, such as increasing intensity, duration, or frequency, can trigger this condition. Additionally, poor footwear choices, particularly shoes that lack adequate support or are worn out, can contribute to the development of shin splints. Certain activities, such as running, dancing, or military training, are more likely to induce this type of pain due to the repetitive nature of the movements involved. Certain risk factors can heighten the likelihood of experiencing shin splints. For instance, running on hard surfaces like concrete, uneven terrain, or uphill can increase stress on the tibia. Individuals with flat feet or those who possess inflexible feet may also be more susceptible. Being overweight, failing to warm up before exercise, or neglecting post-exercise stretching can further elevate risk. Nutritional deficiencies, such as a lack of vitamin D or underlying conditions that weaken bones, can also play a role. The biomechanics of your lower extremities, including how your ankles and hips interact during movement, can significantly influence your risk of developing shin splints. Fortunately, shin splints often improve with conservative management and may resolve on their own within a few weeks. However, several proactive measures can expedite recovery. First and foremost, resting the affected legs is crucial. While complete inactivity is not necessary, Opting for the low-impact activities, such as swimming or cycling, can help maintain fitness without exacerbating the condition. Applying ice to the shins for 20 to 30 minutes several times a day can reduce inflammation and alleviate pain. Consider utilizing insoles or orthotics in your footwear, particularly if you have flat feet or weak ankles. These supportive devices can help redistribute pressure and reduce strain on the shins. Compression garments, such as bandages or socks, may also aid in managing swelling. Additionally, replacing worn-out shoes with new ones that provide adequate support is essential. Consulting with a healthcare professional or a sports medicine expert can guide you in selecting the best footwear for your specific needs. For those experiencing persistent pain, over-the-counter non-steroidal anti-inflammatory drugs, or NSAIDs, can offer relief from discomfort and swelling. However, it is important to use these medications judiciously, as they can have side effects, including an increased risk of bleeding and gastrointestinal issues. Always adhere to the recommended dosages, unless otherwise directed by a healthcare provider. Returning to your regular exercise routine should be approached with caution. It is advisable to remain pain-free for at least 2 weeks before resuming your previous activities. When you do begin exercising again, it is essential to start slowly, gradually increasing intensity while ensuring proper warm-up and stretching practices are followed. Should pain reoccur, it is vital to halt the activity and allow for further rest. Incorporating massage therapy may also provide relief by relaxing the muscles surrounding the shins, although it is wise to consult with a medical professional before pursuing this option. While there is limited evidence supporting the efficacy of massage in treating shin splints, it can contribute to overall muscle relaxation. Lastly, stretching exercises targeting the lower legs and ankles can be beneficial, promoting flexibility and aiding in recovery. In summary, shin splints are a common yet manageable condition, characterized by pain along the shin bone due to overuse. Understanding the causes, recognizing the symptoms, and implementing effective treatment strategies can significantly enhance recovery and prevent future occurrences. As with any injury, listening to your body and seeking professional guidance when necessary is crucial to maintaining long-term health and performance in your chosen activities.